So swine flu is an influenza A virus. It is related to human influenza, but is a different type, a different strain. And one of the features of it that makes it of concern is that it is a novel influenza virus to the human population. So what that means is that the human population has not seen this virus, they've not been exposed to this virus before, and for that reason, essentially no one has any form of immunity to this virus. You know, for the most part, people have been presenting as they would with any kind of seasonal influenza, with the usual symptoms that we see: fever, headache, sore throat, chills, serious muscle aches, and that kind of thing. With this particular strain, there's been descriptions of people with what we call gastrointestinal illness, which is nausea or some vomiting. But in general, it's been presenting very similar to the seasonal influenza. I think that the current recommendation is for people with mild flu symptoms, as they would in any other flu year, they should take the common sense precautions, which really means they should stay at home. They should get plenty of rest. They should do their best not to expose any other individuals, which essentially means stay at home, drink plenty of fluids, etc. So, for people who have no underlying medical conditions and appear to have mild symptoms, that would be the recommendation. Obviously, if they're concerned or if they're sicker than that, then they need to contact their healthcare provider. And basically, for people who come in to essentially the primary care clinics and the emergency department and some of the other clinics as well, they are given a screening questionnaire, which has to do with, do you have a fever? And if you do have a fever, do you have any one of these other symptoms, which are the symptoms I described before? And if the answer to the fever plus the other symptoms is positive, then they are given a mask, they are asked to wash their hands, and they are brought back to a sort of single patient exam room as soon as possible. And there they are evaluated, and from there a decision is made what to do. People should be washing their hands frequently. Sharing utensils is not a good idea, until you wash them. We always recommend that people cover their cough. If there are people who do exhibit signs of an influenza-like illness, which is what we've been describing, the best thing for them is to try to stay, at least 6 feet away from other individuals, if at all possible, and again, practice what we call frequent hand hygiene, and that sort of thing. And there is no current recommendation for people to be wearing a mask to protect themselves. Now, certainly there are always individuals, for instance, those who might be severely immunocompromised, who may have a doctor recommend that. But as sort of a mass approach, it is not currently recommended. One of the features, of course, of particularly children is hand cleansing is, difficult to come by, and they chew on toys and all that, So I think being aware of those kinds of things and really trying to wash hands as frequently as possible, to cleanse off and disinfect toys that are shared, it's very appropriate to do in this setting. We're hearing new updates on an hourly basis. I think it's very fair to assume that things could change at any time. We could become more alarmed, we could become less alarmed. I think being vigilant and that sort of thing is very important. I think panicking is a thing not to do. And I think, again, a reasonable approach based on the data that we have coming in, it's what we will all do and what we will recommend. And, here at UCSD, we've been working with this now, this particular outbreak for, a good week. We are in a mode where we're getting a lot of information, we're synthesizing that information and coming out with the recommendations that we think are appropriate based on the World Health Organization and the CDC recommendations adapted to our own situation here in San Diego, and we'll continue to do that. And I think that I would advise people to, keep to the facts and that sort of thing, and not become overly alarmed.